A group of women say they are very sick with an infection that anyone in Louisiana can get.
But doctors and state health officials doubt their claims, saying the infection is very rare here. Medical reporter Meg Farah sorts out the controversy in tonight's special report.
All of a sudden, I could feel the side of my face tingle. And I was like, let me go look in the mirror, and everything was hanging.
I had such spine pain, like something was crawling up and down my spine. My scalp, I felt like things were crawling on my scalp.
There were days that he had to help me out of bed. I was taking 30-something pills a day. I'm like, I can't, I don't want to take another pill.
I'm gonna get emotional, but we sold our 4-bedroom home over this disease just to try to fund it because insurance is not gonna cover it until the CDC says the truth.
I still can get where I forget my husband's name. And it's in my brain. I just can't get it out.
5 women from different places across Louisiana. Among them, nurses, working professionals, wives, mothers. But their close bond is from something else they have in common. Something they say is destroying their lives, families, careers, bank accounts, and reputations.
If you would have told me 4 years ago that an insect bite would have bankrupted me, had people tell me I needed to go see a psychologist and brought my family down to their knees, I would never have believed it.
They believe they have in common a bite from a type of arachnid, only the size of a sesame seed. The deer tick is mostly known for spreading Lyme disease in the Northeast. They say because they're in Louisiana, no one believes they have Lyme too.
I've had infectious disease people, and I kid you not, in Metairie, hang up the phone on me.
My first one that I asked to do a Lyme test laughed at me and said, wow, aren't you pulling for straws?
I brought up the Lyme, and he literally laughed at me and said, you don't have Lyme. You live in Louisiana.
They've been to specialists, neurology, endocrinology, rheumatology. But lupus, multiple sclerosis, rheumatoid arthritis have been ruled out. So they're told it's fibromyalgia or mental illness.
And he said I was going to get a psych consult. My problem was I was sick. Yeah. And a psychiatrist cannot fix tachycardia, dementia.
I go to the doctor, I'm say I'm really tired, this is just not normal. Well, maybe you're depressed. I'm like, no, I'm not depressed. If I was depressed, I'd admit that because that means I could get better.
Some have papers with positive test results for Lyme. Others remember getting the classic bullseye rash with a black speck in the center. Some just suspect they have it for other reasons. Despite what many think, the deer tick is here in southeast Louisiana. Jars and jars of them were gathered right outside of the Tulane Primate Center in Covington. Tulane's Dr. Monica Embers is a microbiologist and immunologist, studying the bacteria that causes Lyme for years. She says the state doesn't see as much Lyme as the Northeast because fewer local deer ticks carry the bacteria that causes it. Still, she says Lyme is underreported here.
The Lyme diagnostic tests are not very good.
And she says the few cases reported by doctors in Louisiana each year is likely much lower than actual cases. That's based on a CDC study of health records of the entire country.
And they found that where the physician reporting was around 30,000 cases per year, the actual number of cases was closer to 300,000.
The Infectious Disease Society of America and CDC recommend a few weeks of antibiotics to treat the bacteria. But Dr. Embers found something surprising when she used that same treatment, even at higher doses in primates with Lyme.
We were able to recover the Lyme bacteria after that antibiotic treatment, which then proves that the treatment does not clear the infection.
You can see the spirochetes, those corkscrew-shaped bacteria, under her microscope. They travel through the body, causing nerve, heart, muscle, brain, and joint inflammation and damage.
And that's probably the biggest problem with this, is that there is no objective way for the clinician to determine that the patient has cleared the infection.
The women say only 1 or 2 doctors in the state will give them much longer courses of antibiotics. They fear their medical licenses would be in jeopardy if they shared their names. But the State Board of Medical Examiners says they only look into doctors with complaints against them. So far, none involve Lyme treatment. Still, doctors told us off camera that these Lyme claims are, quote, crazy. And some MDs fear those treating beyond guidelines could be doing it for money since insurance doesn't pay. LSU health infectious disease expert Dr. Fred Lopez agrees with the current treatment and says long-term antibiotics can have bad side effects.
These long-term treatments have never been proven in a scientific manner to be effective.
But he says no antibiotic can help those with post-Lyme syndrome, all of those lingering health effects. Dr. Ember says because there are so many deficiencies in diagnosing and treating Lyme, her team's working on a new diagnostic test. At the LSU Veterinary School, Dr. Britt Grasberge is working to find out what's in the tick's saliva that signals the bacteria to move towards it and into the bug. Finding that could mean a new, better test.
Who knows, maybe even we could use it to pull bacteria out of a hiding place and then treat them and make people feel better.
Still, the women want to stop traveling for treatment and want help beyond the standard treatment near home.
I have found that it's very hard in Louisiana to get anybody to say anything about this disease.
I'd cry to every doctor, please, just give me my life back. I don't want a medicine, I don't want a drug, I want my life back.
Meg Farris, Eyewitness News.
The women say there are 118 people in their online support group. We have links and statements from the CDC and the State Department of Health and Hospitals on WWLTV.com.